How's it going, guys? Medium difficulty question, MSK Derm, steps 1 and 2. 51-year-old woman with dermatomyositis, very buzzy, easy image of the Gottrin papules, reddish violaceous lesions on the knuckles. Can also get mechanic's hands, shawl rash, heliotrope rash. Don't confuse the latter with the malarash or lupus. You're going to get CD8 plus infiltrate within muscles. Polymyositis plus skin findings is dermatomyositis. So with polymyositis, you're going to have proximal muscle weakness, an increase in creatine kinase. You need at least one of those two in the vignette to differentiate from polymyalgia rheumatica. The latter, you're not going to have either of those two, will simply be proximal muscle pain and stiffness. So there's more we'll talk about, but let's just whip through the question. What are you most likely to see in this patient who has dermatomyositis? Choice, the antimicrosomal antibodies, wrong fucking answer. First, a Hashimoto thyroiditis, aka antithyroperoxidase antibodies, can also get antithyroglobulin. But for Hashimoto, the biggest value point I can give you is that you need to extend your knowledge base beyond the mere constipation, brittle hair, dry skin, weight gain. Those things are very step 1 level. You can get menstrual irregularities. They love that. You can get bradycardia, transaminitis, so AST or ALT can be elevated. I've seen that on NBME. You're like, why the fuck are they liver enzyme high? You can get that with thyroid dysfunction. Also, high cholesterol, increased CK, hypothyroid myopathy. Wrong fucking answer. Choice B, anti-mitochondrial antibodies, wrong fucking answer. So this is going to be primary biliary cirrhosis, woman 20s to 50s, generalized pruritus, high cholesterol, high ALP, high direct bilirubin, and they'll often tell you a family member has an autoimmune disease. Wrong fucking answer. Choice C, antiphospholipid syndrome, wrong fucking answer. Can be seen with lupus. So you're going to have antibodies against beta-2 microglobulin or cardiolipin. In a patient who has SLE, we simply call those antibodies lupus anticoagulant, but it's the same disorder. So it's a very important cause of recurrent miscarriage in patients who have SLE. You're going to get thromboses within the microvasculature going to the placenta, causing uteroplacental insufficiency, exceedingly high yield for 2CK, OBGYN especially. And antiphospholipid syndrome, whether you have SLE or not, you need to know that this causes an increased PTT, but we get thromboses in the patient, which is paradoxical, right? So if you had an increased PTT, you'd think you'd have increased bleeding diathesis of some kind. But you're going to have, so in vitro, increased PTT, but in vivo thromboses. It's because you need phospholipid for the in vitro assay to work properly. Wrong fucking answer. Choice D. Actually, real quick, you should know that patients who have antiphospholipid syndrome, they can get a false positive syphilis test, VDRL, okay? So that can show up on the USMLE. As I already said, wrong fucking answer. Choice D, hamartomatous clonic polyps refers to Qbank, wrong fucking answer. Okay, I mean, some of you just see a strange answer, you choose it. So this is where Qbank syndrome is perioral melanosis, fancy way of saying hyperpigmentation on the lips. They'll show you the image of the lips. I think it's maybe even the first image in my GI PDF or one of them. And then the answer can just be hamartomatous for the types of polyps you'll see. They can have hyperplastic, juvenile, tubulovillus, all these types written out, and the answer is just hamartomatous. Very easy. Wrong fucking answer. Choice C, ovarian cancer, correct answer. Now, if you've heard of this before, you say, super easy, I answered this in half a second. That's cool. Many of you are like, what the fuck? Okay, this isn't my opinion. You need to know it shows up on the NBME that dermatomyositis can be a paraneoplastic of ovarian cancer. It doesn't matter the specific type of ovarian cancer. Ovarian serous adenocarcinoma happens to be the most common variant, but you just need to know that dermatomyositis can occur as standalone autoimmune disease. Okay, but they are known to ask ovarian cancer as a cause. Not a big deal, okay? The same exact way you're aware of other paraneoplastic syndromes. You know squamous cell of the lung can secrete PTHRP. Small cell of the lung can secrete ACTH causing Cushing, SIADH. Lambert-Eaton, cerebellar / neuronal dysfunction. RCC, kidney, can also secrete PTHRP similar to squamous cell of the lung, can secrete EPO. So you're aware of various paraneoplastic syndromes, but holy shit, let's add it to our repertoire that ovarian cancer can cause dermatomyositis. You get anti-Jo1, MI2 antibodies, okay, with this condition, polymyositis / dermatomyositis, but I just want you to be aware of the association. Choice E, correct answer. You know the deal to make more content, like my stuff, Appreciate your time. That's it.